Hi, I'm Dr. Greg Ellis, and we're talking about the cholesterol scam, the myth that there's a relationship between dietary fat and heart disease. We will find out later on that there actually is, but during the first 50 years of this argument, they couldn't find anything. Now, what are some of the glitches that appeared along the way? Well, one is the Masai warriors in Africa. It was realized that they were living on meat, milk, and blood of the animals. And they had very low cholesterol levels. Heart disease was non-existent. Some people suggest it was a genetic component, yet when the Masai left the rural setting and took up living in the city, their cholesterol rapidly increased. So clearly a lot of saturated fat in the form of milk and meat, and probably a lot of saturated fat in the blood, made no difference to the Masai. So that was the first major glitch, and that was discovered in the mid-1970s when a Vanderbilt University professor, George Mann, traveled to Africa to inspect the lives and the health and the blood of the Masai warriors. Now, later on, they thought they could settle this whole thing because there were all these studies that went on over the years that very often did not show anything at all. So they set out to do a study called the Women's Health Initiative. And this looked at 48,000 women that they divided into two different groups. And they significantly reduced the saturated fat in their diet in one group and left it alone in the other, expecting to see important changes in the rate of heart disease and stroke. Well, after 8 years of looking at the data, there were no differences between the groups. So that was the study to end all studies. That was the study that was going to prove it. And of course, it did not prove it at all. Now, there's another collaborative group called the Cochrane Review Group. And this is a real serious group of researchers. So got a lot of the researchers together in the Cochrane, and they looked at all the studies that had been done over the years, and they were very controlled in what they did. Very significant criteria to accept the study and look at an evaluation of it. And if it didn't meet these criteria, it was rejected. So they ended up looking at 27 different studies, and they found that there was no evidence whatsoever that there was a relationship between diet and heart disease. So this really confused a lot of people because they had become convinced that there was. This whole community had convinced themselves that this relationship existed, and it did not. So here we are, some 60 years later, after the first idea that there was a relationship between dietary fat, cholesterol, and heart disease, that is not there. It's not there at all. So now the next step is to move into the early 2000s and look at the type of studies that have been coming out since then and what they're finding and what they're showing. And these are studies by real scientists looking scientifically at the facts about diet. So I'm going to begin to cover that in the next video. I'm Greg Ellis.